So today we're going to be talking about the different types of HRT, hormone replacement therapy, that we can give through the skin. Usually we use hormone replacement therapy as estrogen through the skin because we know that it's currently the safest way to take it with no increased risk of blood clot or stroke or heart attack. The main types we use come as estrogel, which is as a pump, Lenzetto, which is a spray. We've also got a patch here as well, which you can apply to the outer thigh. So estrogel is a really good way to have estrogen through the skin because it's absorbed really well. And it comes as a gel which is rubbed in to the inner thigh or outer arm every day on a daily basis, and it absorbs really well. The alternative way to take estrogen through the skin is as a patch, and this is just one type of patch of which there are many. And it comes as a small sort of sticky patch which you apply to your outer thigh and change twice a week. Again, there's various strengths of these, and depending on your symptoms, your doctor will be able to prescribe the appropriate amount. The Lenzetto spray is just that. It comes as a spray and you would apply it to your forearm, and depending on the dose, you would squirt the spray onto your forearm, move the spray up and apply it like this. And again, it depends on the dose, it depends on how many sprays you might need, but your doctor will be able to explain exactly what your dose might be. If you still have your womb, so if you've not had a hysterectomy, you will need to use a progesterone in addition to the estrogen through your skin. And this is because estrogen increases the lining of the womb and progesterone stops it getting too thick. So they sort of balance each other out in a way. The way we give progesterone these days is in the form of Utrogestan, which is a micronized progesterone. All that means is that it is body identical. It resembles what your ovaries produce. And depending on where you are in the menopausal transition, you would either take this every day or you would take it for part of the month.